Welcome to the COVID-19 Antibody Kit Test. My name is Dr. Oscar Barreto. Today I'll be explaining how to use this kit test. First, it comes with the instructions, as you can see. Very simple to follow. These are the items. You have the alcohol prep, followed by the lancet. Then you will see the actual pipette. At the end here, you'll find the reagent. And this is the actual test. You take your specimen, take the patient, you take your lancet, and you should go to the most lateral aspect of the digit where they'll have least discomfort and you'll get maximum blood. You squeeze gently in order to express blood, and then you'll take your pipette to extract the blood from the digit. At this point, you'll take the pipette and you'll put the blood into the reservoir of the actual test. And this is finally followed by applying 2 drops of the reagent. Once the drops have been applied, you start the 15-minute clock. Here you will observe the actual indicators moving up in the test. The first thing you'll identify is that in order for the test to be valid, the C line, which is called the control, has to be present. At that moment, you will also be monitoring for any other line to be identified, which will be the IgM or the IgG. At the 8-minute mark, you can see the control line clearly identified, which means that the test is working correctly, and now we're just waiting to see if any other identifier is noted. As we reach the end of the clock, you can clearly see that the C line, which is the control, has been identified. What does this say? This has told us that this patient has no antibodies to the COVID-19 virus. And finally, if the test had shown a line in the IgM or IgG or both, what it would have told us is that the patient had antibodies to the COVID-19 virus. I'd like to remind you that this test is not a PCR test. Therefore, it's not testing for the actual virus in the body. It's testing for the antibodies of the virus. Thank you.